Megacode number 2, tachycardia, cardiac arrest to post-cardiac arrest. So you have a 65-year-old patient today who arrived at your ER with a chief complaint of dizziness. We put him on the monitor. We see a wide complex tachycardia with a rate of 165. Blood pressure is 110/70. Respiratory rate of 12. And the patient is 98% on room air. So that's V for vitals. O, oxygen. Doesn't really need oxygen right now at this point. M is monitor. This reminds me to get the 12 lead. I for IVIO. We're going to go ahead and get access. And then in terms of T treatment, are they stable versus unstable? Now the stability is going to be dependent upon end organ perfusion. The brain, are they altered? The heart, do they feel chest pain? The lungs, do you hear crackles in their lungs suggesting acute heart failure? And then the skin, are they perfusing well? Or are they pink, warm, and dry? Or are they pale, cool, diaphoretic? We'll say that your patient is in fact stable. So in this case, we're going to go chemical. So your ER physician orders you to give 150 milligrams of amiodarone added to 100 cc's of normal saline given over 10 minutes. Now, as we do that, we place the defibrillation pads on the patient as a precautionary measure. Now, about 5 minutes into the therapy, your patient clenches their chest, severe chest pain, acute difficulty breathing. We're going to go ahead and synchronize cardiovert the patient. So we charge up 100 joules of energy on the monitor. It is synchronized. We shock the patient. Momentarily, the rhythm goes away, and we have recurrence of monomorphic VTAC once again. So at this point, what we're going to do is increase the joules and synchronize cardiovert one more time. We shock the patient, we synchronize cardiovert, and the patient goes unconscious. The rhythm is the same. Patient is now pulseless. So this is no longer called monomorphic VTAC. This is now referred to as pulseless VTAC. So immediately, what do? Start chest compressions. Charge the monitor. Now it's unsynchronized, right? We're going to increase the joule amount to 120 joules. We're going to defibrillate and immediately resume with chest compressions. So at this point, we'll make sure that the airway and the breathing is set up, and we continue our CPR. Now, 6 minutes into the cardiac arrest, we have an organized rhythm on the monitor. End tidal spiked from 20 millimeters of Hg while performing CPR to 60 millimeters of Hg. Patient, we do not detect a pulse, so we resume CPR. Okay, so 2 minutes later, patient has a pulse, currently unconscious. What do we do next? So remember your BLS assessment first. So don't jump to ALS immediately. Are they breathing? Right? So that'd be a critical fail if you went beyond that. So make sure the patient is actually breathing. So we're going to ventilate every 6 seconds, recheck pulse every 2 minutes. We want to stabilize our patient. How do we do that? ABCs, right? So A, airway. Think about intubating this patient. B, breathing. We're doing that for them. C, circulation. Do they have a good blood pressure? Have we gotten a new set of vitals? So we can treat the blood pressure, of course, with fluids and pressors. And then in terms of D, diagnostics, we can get a 12-lead EKG on the patient. You can check their glucose level. You can order labs, etc. So in summary, we had a stable, wide, complex tachycardia. We treated it with chemical. Once the patient became unstable, we treated it with electrical, synchronized cardioversion. Notice in the Megacode that the patient's rhythm did not change, but they went from conscious to unconscious. So it's not always that obvious. So we want to make sure we're doing our BLS assessment. We check pulse, didn't detect one, charge the monitor right away while starting compressions. We defibrillate and immediately resume with chest compressions. Notice also that the patient's end tidal spiked from 20 to 60 millimeters of mercury. This doesn't necessarily mean that you have achieved ROSC, despite the fact that there was an organized rhythm. So we resume with chest compressions, and then 2 minutes later, they regain their pulse. At this point, remember to do your BLS assessment all over again. Is the patient breathing? We treated that with now a respiratory arrest patient, and now we want to stabilize. So remember your ABCs: airway, breathing, and circulation.